Okay, chapter 8 of Professional English in Use. Allied health professionals. A. Community health. The health of the community depends on a large number of people other than medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They include the following. First, physiotherapists or physios help people to move by getting them to do exercises or by treating their body with head or massage. Treatment by manipulating muscles and joints with the hands. Two, occupational therapists help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. 3. Social workers help people to solve their social problems, for example, for housing or unemployment or family problems. And the last is a chiropodist, also known as podiatrist, treats conditions affecting the feet. B. Technicians. There are numerous technicians, people who work with scientist equipment, such as radiographers, who are known as X-ray technicians. Ambulance technicians work in the emergency medicine services. An ambulance technician with more advanced qualifications, it's called a paramedic. C. Prosthetics and orthosis. Prosthetics and orthosis provide care for anyone who needs an artificial limb, a prosthesis, or a device to support or control part of the body, and orthosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prote- Prosthetics provide artificial replacement for patients who have had an amputation or were born without a limb. Orthotics provide a range of splints and other devices to aid movement, correct deformity from abnormal development of part of the body. For example, club foot, talipes, and relief pain. Then, opticians. Opticians test eyesight and prescribe glasses, also known as spectacles, and contact lenses when necessary. The examinations includes measuring intraocular pressure, the pressure of fluid inside the eye, and examining the retina. If the optician suspects an eye disease such as glaucoma, to refer the patient to their GP for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in disease of the eye. Perfect. So we're gonna be translating into Spanish now. 8. Profesionales de la salud afines. A. Salud comunitaria. La salud de la comunidad depende de un gran número de personas, además de los médicos y enfermeras. Estos se pueden agrupar bajo el título de profesionales de la salud. Eh, Estos incluyen los siguientes. Los fisioterapeutas ayudan a las personas, o sea, los fisioterapeutas o oficios ayudan a las personas a moverse, haciéndoles hacer ejercicios o tratando su cuerpo con calor o masaje, manipulando los músculos y las articulaciones con las manos. Los terapeutas ocupacionales ayudan a las personas con discapacidad a realizar tareas en casa y en el trabajo. Una discapacidad es una condición física o mental que dificulta una vida normal, por ejemplo, ceguera o sordera. Trabajadores sociales ayudan a las personas a resolver sus problemas sociales, por ejemplo, eh, problemas de vivienda, o sea, tienen una casa pobre o desempleados o problemas familiares. Los podólogos, también conocidos pues como podólogos en español, o sea, podólogos o podiatras. Tratan afecciones de los pies. B. Los técnicos. Hay numerosos técnicos que trabajan los equipos científicos como los radiólogos, conocidos como técnicos de rayos X. Los técnicos de ambulancia trabajan en el servicio de medicina de emergencia. Un técnico de ambulancia con calificaciones más avanzadas se le llama médico. Cualificaciones. Prostéticos y ortesistas. Los prostéticos y ortesistas brindan atención a cualquier persona que necesite una extremidad artificial, una prótesis o un dispositivo para sostener o controlar parte del cuerpo, una órtesis. También asesoran sobre rehabilitación, ayudando a los pacientes a volver a la vida normal y al trabajo después del tratamiento. Los prostésicos proporcionan reemplazos artificiales para pacientes que han tenido una amputación o que nacieron sin una extremidad. Los ortesistas proporcionan una variedad de férulas y otros dispositivos para ayudar al movimiento, corregir la deformidad causada por un desarrollo normal de una parte del cuerpo, por ejemplo, un pie zambo, talipes, y alivia el dolor. Ópticos. Los ópticos examinan la vista y recetan gafas, también conocidas como anteojos, y lentes de contacto cuando es necesario. El examen incluye la medición de la presión intraocular, la presión del líquido dentro del ojo y el examen de la retina. Si el óptico sospecha una enfermedad ocular como el glaucoma, deriva al paciente a su médico de cabecera para su tratamiento. El médico de cabecera puede entonces derivar al paciente a un oftalmólogo, un médico que se especializa en enfermedades de los ojos. Okay, perfect. Now we're gonna be reading the exercises in English. Okay. 8.1. Make word combinations using a word from each box. Look at A, B, C, and D opposite to help you. Uh, so we're gonna make combinations with these words. Okay, ambulance technician, artificial limb, a cloud fault, contact lens, health professional, intraocular pressure, occupational therapist, and social worker. Which allied health professional could best help the following people? Look at A, B, C, and D opposite to help you. A young unmarried woman who has just had a baby, social worker. 2. A woman who is having difficulty using her right arm following a fracture, a physiotherapist. 3. Someone who needs glasses, opticians. 4. An elderly woman who has had a below neck amputation, prosthetics. 5. A man whose wife has Alzheimer's disease, social worker. 6. A man with a fungal infection of his feet, podiatrist. 8.3. Complete the test. Look at A and C opposite to help you. A prosthetic works with patients of all ages as a member of a clinical team based at a large hospital. The patients may need a prosthesis as the result of an accident or amputation. Following a disease such as diabetes, alternatively, they may have been born without a limb or tortoise, work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. The main aim is to enable the patients to lead a normal life at work and leisure. Underjudges often work in a clinic and as part of an outpatient services and also visit other centers to provide services for people with special needs. They deal with people of all age, for instance, children who have cerebral palsy might require splints to help them walk, and many other people need special shoes to correct deformities. If damaged, any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition to the body or to relieve pain. Okay, thank you for your attention. So, see you next chapter.